Fantastic. And I have to say, I mean, it might seem like a small team of people at the moment, but I'm absolutely delighted and proud of working in the Black Country, where we have, through our community transformation and our other financial support around mental health, that we have now developed an Admiral Nurse service that is one of the strongest Admiral Nurse services and the fullest spread of Admiral nursing across the country. It's not just in the Midlands. You know, this is a really, really great offer around our dementia care pathways within the Black Country. And in my career, I first came into contact with Admiral nursing in 2004, 2005, and I've been a huge fan ever since, and a huge advocate ever since of Admiral nursing. I can imagine a number of you on the call will know of Admiral nursing and will have a good idea of Admiral nursing. I'm hoping also people on the call, you know, Admiral nursing is very new to you. And I'd really looking forward to today, for this morning, that, you know, we can really share our Admiral Nurse service with you, how the history, how it's set up, and how we are rolling this out within the Black Country at the moment, and how we are going to link with yourselves as other providers and other organisations within the Black Country around all the needs and the care of people with dementia, and in particular around the carers, of course, for this service. I hope you've all had sight of the agenda. We've got it here now at the moment, so we're going to start off in a minute with what is Admiral nursing from Luke, and then the Admiral nurses are going to do their presentation, and then we're going to chat in locality groups. We're going to do some breakout rooms, so each of our localities, each of our boroughs will break out into breakout rooms, because there are some subtleties and differences and nuances in each of our boroughs around how Admiral nurses are, how dementia pathways are in each of the boroughs. We're going to have a break, of course, because it is quite a long morning, and then we're going to have feedback from those locality rooms. We're also going to talk about referrals, data, diversity, and very importantly, a carer story as well, which we do find is usually one of the most hard hitting of things within these type of events, is, you know, really hearing it from the people who are going to hopefully benefit from this type of service, and people who have benefited from this type of service in previously as well. Questions and answers, please put questions by all means in the chat. As I've already said, put them in the chat, but I'm sure there will be also opportunities throughout after presentations, etc., for people to ask questions as well, and we'll do our utmost to answer those questions. And if we don't have the answers today, then obviously we'll endeavour to get back to people with those answers, and we'll take some actions out of today. And we'll close, and then we'll close. We're hoping to close at around 11:30. So hope that's fine for everyone. So with no further ado, as they say, can I move on to Luke, please? Thank you.
Yeah, thank you, Nick. So first of all, just to kind of go over again, I'm Luke Warby. I work for Dementia UK as a regional account manager. And I essentially work across the West Midlands and Wales, and hold a kind of portfolio of different Admiral Nurse service accounts across that region, and work alongside the host organisation and lead nurses for those services to ensure that they kind of flourish and go in the right direction in terms of what the host expectations were, as well as Dementia UK. And it's great to see so many people logging on to this call to an event today, so that we can really give you an example of a great version of an Admiral Nurse service that we have, and also give you more information about what the benefits of this Admiral Nurse, the Black Country service, has for you all, and how you're all able to kind of connect to it and work alongside it. So for this first part, I'll just give you a bit of an introduction to Dementia UK and what is Admiral Nursing. As you can see on the slide on the presentation, gives you a bit of an oversight of Admiral Nursing. And for those that don't know and aren't aware, Dementia UK is a specialist nurse charity. So what we essentially do is we support and develop nurses, known as Admiral Nurses, who are dementia specialist nurses that provide support and care for families affected by all forms of dementia. As dementia specialists, Admiral Nurses our aim is to help families manage complex needs and consider the person living with dementia and the people, the family around them. And they also help to advise other healthcare professionals as well. So really looking at the holistic approach for the person with dementia and supporting families and carers around that person with dementia. We believe as a charity that Admiral Nurses give people the quality of care that we would all want ourselves and our loved ones to have. And we're working hard to increase the number of Admiral Nurses across the UK, so no one has to face dementia alone. And I'll come on a little bit later, a bit about our strategy and how we've kind of developed as a charity, but also the number of Admiral Nurses and services that we have. So the Dementia UK, well, actually, the charity was founded in 1993 by a family of a gentleman called Joseph Levy. Joseph Levy suffered from vascular dementia, and he was known affectionately as Admiral Joe by his family and friends because of his love of sailing. And you can see on the screen the picture of Admiral Joe there. When Admiral Joe was diagnosed, the family found it difficult to cope with the changes that occurred and decided that they needed specialist dementia nurses to help support the family through the changes and with diagnosis. So it was in the early 90s. This was when the first 3 Admiral Nurses were developed and were based in London. And as Admiral Nursing has grown and become bigger, and the charity has evolved and developed, the charity actually formally became known as Dementia UK in 2010. Basically, the charity has spent the intervening years growing our services across the UK. We've now got hundreds of nurses, Admiral Nurses, working across different settings, all with different service specifications alongside them within the community, hospitals, care homes, and we also have our helpline. And all with the aim of supporting thousands of families facing dementia and give access to that specialist dementia expertise. So that just takes me on to a bit about the formation of our current strategy that we're in at the moment. So our current strategy was formed in 2020 and lasts until 2025. And within this, we have 6 key priorities. One of which is to grow Admiral Nurses within the community. One is to grow the number of Admiral Nurses within hospitals. One is to continue to grow our helpline. Another to develop and deliver our Dementia at Work resource. Another to develop Admiral Nurse posts in areas of specialism, such as learning difficulties and diverse communities. And another to develop our own digital platform. And it's a great pleasure, and we're proud that this Black Country Admiral Nurse service that you're here today for delivers on 2 of those 6 priorities of the strategy, which includes growing the number of nurses within the community setting and developing Admiral Nurse posts in areas of specialism. And in addition to that, I mentioned earlier on that we've obviously grown and developed hundreds of Admiral Nurse posts throughout the years. And it was earlier, not too long ago, that our CEO, Hilda Hayes, set a target of having 500 Admiral Nurse posts by 2025. Excuse me. And we're well ahead of this target, I'm pleased to kind of report. And as of today, I can confirm that there are 408 contracted Admiral Nurse posts, which is excellent. And that just shows how much we've grown since the early 90s. And how many posts and how many organisations that are working with us to support carers, families and people with dementia, and creating those opportunities for families to get the help they need. So as I say, we're now at 408, well above the target of 500 for 2025, and no doubt we'll be hopefully by the end of the year nearing that 500 number, if not surpassing it. So just moving on to the Black Country service itself, this service forms a big part of that number. It has a total of 7 Admiral Nurses and is the largest community-based Admiral Nurse service that we support within the UK, and one of the largest just generally overall Admiral Nurse services that we support. over the past 12 to 18 months, Nick and a colleague of mine, Jen, have helped to develop what the service is today. The original service was within Wolverhampton, which had 2 Admiral Nurses, and that began to be formed in late 2020, I believe. And we also had a separate Admiral Nurse service in a different organisation, which was the Dudley service, which had 2 Admiral Nurses as well, and was also formed in 2020. So kind of moving forward to where we are today, the service has evolved and developed to form the Black Countrywide Admiral Nurse service, and with a total of 7 Admiral Nurses. And it was at the start of this year or the latter end of last year where we worked with Nick to expand the Wolverhampton service to cover Sandwell and Warsaw with an additional 2 Admiral Nurses. And a little bit later on, not too long after, Dementia UK also had an opportunity to invest as well to support the trust to develop a diverse communities Admiral Nurse post. And that post is actually completing a developmental programme alongside Dementia UK, known as the Accelerated Learning Programme, where they work with Dementia UK to develop their Admiral nursing skills and expertise alongside their role within the service. And then later on during this year, more in the summer, we had the Dudley Admiral Nurse service, which merged over to the Trust in July. And this was to form now what is known as the Black Countrywide service. And I think everyone on the call here would, and especially the people involved with the Admiral Nurse service, will agree that it's such an exciting time for the Black Country to have this support for the carers and families with dementia. And we as a charity are proud to obviously be supporting and collaborating with the Trust to have developed this really exciting service and large service. And we're really excited to see how it develops over the coming months and years and the impact it'll have on all families and carers and those people living with dementia. So on that note, it's just to say thank you to Nick and the Trust as well in working with us at Dementia UK to help develop this service, but also to the Admiral Nurses who deliver the service on the ground floor essentially, and the fantastic work that they do and the effective work that they do on the daily service, serving the people with dementia, the carers, and supporting the families.
So thank you, Luke. That was really, really helpful around the background of Admiral nursing history. And now we've got, I believe is it Stacey?
It's Wanda.
It's Wanda. Apologies.
Okay. So this is a little bit about the aims of the Admiral Nurse service. This is what we hope to achieve from having an Admiral Nurse. So our focus is to improve the well-being and quality of life of people with dementia and their families and carers. We aim to improve families' communication and their relationships and help people to live more positively with dementia. We work with the family, carers and the person with dementia to provide them with specialist knowledge, support and training in hope that it will lower levels of depression, anxiety and guilt in their caring role and help people to feel empowered, improving the carer's confidence to make informed decisions. We also aim to give people a better understanding and help them with access to information and services with support available within their community. I can hear the noise from the video, I think now. Can you all still hear me? Okay. We are hoping to ensure that carers are looking after their own physical and mental health to help them to maintain their resilience and have an improved level of satisfaction in their caring role. Hopefully with our input, there will be some improved well-being and quality of life for the person living with dementia, and the family will have access to services and care that they need. We also try to facilitate future planning and help them to tell people what their wishes are if they want to do so. And also we help to reduce GP call-outs and reduce inappropriate acute hospital admissions, and also reduce the use of formal social care services and delay transition into care homes. Thank you.
Thank you, Wanda.
Okay, so this I'm Stacey Harrison. I'm the team manager for the Admiral Nurse service. I'm just going to go over some of the areas of practice that you may find Admiral Nurses. Luke has pretty much mentioned. We are commissioned to be Admiral Nurses within the community, linked with the Black Country NHS. However, you might find Admiral Nurses in some care homes or the acute settings and hospice. We also have with us today some Admiral Nurses from other boroughs, and I think they've already been sharing their details in the chat. And we've got our colleague Ben, who's introduced himself to just talk about his role as an Admiral Nurse and the links with Royal British Legion. And then Justine's going to tell us about the Dementia UK Helpline and the clinics that Dementia UK are sharing around the boroughs. Ben, are you okay to just tell us a bit about the Royal British Legion Admiral Nurses?
Yes, Stacey, thank you. Thanks for that introduction. It's great, just first and foremost, folks, it's great to see so much interest in our sort of in Admiral nursing as such. It's a little bit confusing when you see people pop up from charities and different areas, but obviously there is Admiral nursing within the charitable sector, and indeed, as Stacey mentioned, in other areas as well. So about 10 years ago, the Royal British Legion wanted to look at supporting if you like, some more of our older beneficiaries, not just people who are coming out the armed forces sort of imminently or due to come out. And we looked at some of the areas where we could support them and set up some small teams of Admiral Nurses across the country. There is a team in the West Midlands, which I manage, of 4 nurses and myself, and also teams in Hampshire, Cardiff, Leeds and Manchester. The one significant thing over the last year or two is that we have spread into other areas, into the east towards Leicestershire and over into North Wales. So we're a West Midlands based service, but we are looking at supporting families who have beneficiaries within their family of the Royal British Legion in other areas as well. The one significant thing, folks, is, as I've said, we are associated with the Royal British Legion. I think you all have, especially recently, all have some sort of insight into the Royal British Legion, a charitable service for people who have served in the British Armed Forces. And our clients stroke beneficiaries can be only have needed to have served for 24 hours at one point in their lives to be a beneficiary of the Legion. So not only do we have the Admiral Nurse service, which I sort of manage in the West Midlands, we have other services which maybe some of your clients may well benefit from going forward, such as financial support and various other. We have various care homes across the country as well. Significantly, what we've asked for really as these services grow is that everybody is mindful if anybody who has dementia or indeed their carers are beneficiaries of the Legion, with that status, what I said about the 24 hours of service within the British Armed Forces. And because I know, unfortunately, because of the prevalence of this illness and dementia, you know, I know how busy you are. So if we can help our colleagues in statutory services going forward in all the Black Country areas you just mentioned and across the country, if we can help with that and provide a service that runs parallel with you guys, I'm really hoping that's going to be the future. In terms of working alongside our colleagues in the NHS and other areas, I think that's going really well. I've been very welcomed into such meetings and are often updated into the services which are happening across the Black Country. But it's quite a seismic change, really, because 10 years ago when we started this service, there wasn't any Admiral Nurses sort of in the area, and now there are many. Now that's obviously there's lots of nurses now, and that obviously we're looking at our positions and we're looking at what we can do. But
sorry, Ben, you've inadvertently gone on to mute.
Oh, did somebody put me on mute? I was going on that much. Sorry about that.
I'm sure not. I'm sure
so yeah, so I mean, and any questions regarding that service, our service, please let us know. But I mean, if we just think about military sort of activity, a lot of our client group, due to the age bracket, if you like, now did something we call national service. And national service was sort of what most gentlemen had to do in the late 50s and 60s, and it was a 2-year service. Unfortunately, a lot of my beneficiaries that served in the Second World War are passing now, or are very elderly, or in their late 90s. We are supporting some, but it is this sort of national service where a lot of our clients, and if you can ask anybody who you feel might need an Admiral nurse, obviously we have our teams in the statutory services as well, but if you can ask, we can be of some help as well. So thank you for the opportunity, for letting me to just voice our service. Thank you.
Great, thank you, Ben.
Thanks, Ben. Justine, do you want to tell us a bit about the helpline and the clinics?
Thank you. Can everybody hear me okay?
Yeah.
Lovely. Yeah, hi, my name's Justine and I'm a consultant Admiral nurse here at Dementia UK. So I just wanted to talk to you about the helpline. It's been going for many years now and it's gone from strength to strength. It's open 7 days a week and every day apart from Christmas Day. People can leave a message and we do call people back, or they can email us. It's a free phone number from all landlines and most mobile phones, so people have to check with their provider. It is absolutely wonderful resource that is managed by 47 plus Admiral nurses on a rota system. And these are Admiral nurses that have been there, got the T-shirt. They've set up services. They've been around Admiral nursing for many, many years. They've got very different and very complementary specialisms, and we're very proud of the helpline. Since the pandemic, we are now receiving and taking calls from over 72,000 people. And that is a massive increase of 34% since 2019. So why are people contacting us on the helpline? So we've narrowed it down to the 5 main areas, and they are obviously COVID-19, which has caused a lot of issues, not only with people going and getting a diagnosis, but actually managing loved ones. And a lot of families moved in with their loved ones or moved their loved ones in with them. So it's a lot of support and guidance and help and onward care. The second most common theme is behaviour. So it may be supporting somebody who may be agitated, paranoid or suspicious, managing delirium, which is massive. The meanings behind language and words. It can be really, really hard for a primary carer that's living every day with somebody who is struggling to get their words out and dealing with those frustrations. And people need validation of what they're doing is the right thing. And that's really, really hard for carers. So going along with that is the psychological and emotional support that we can offer, especially around people, which we're seeing a growing area is young onset dementia, people feeling very isolated and alone and overwhelmed, you know, that loss of confidence in your abilities, and dealing with those physical manifestations of anxiety, which can be so encompassing on carers. And again, multiple losses. This isn't how we planned our retirement. This isn't how we wanted our future to look after working for 30 plus years. This wasn't in our scheme of things, you know, and everything's now on hold. You know, we were looking after grandchildren, we were having fantastic holidays, our life has changed substantially, and how can we deal with that loss? Going to the GP visit and feeling not listened to, not able to talk, not having that time, and medication, of course, that is absolutely massive. Followed by getting a diagnosis. Now, we all know that varies from place to place, and it is a postcode lottery. And since COVID, we know that things haven't gone back to normal. people face a lot of confusion, barriers, stigma, fear, not wanting to discuss what's happening, or unwilling to go and see the GP, lack of confidence, even if they could be offered an appointment to take those first steps. So that is a lot of calls, a lot of areas of concerns. And basically, people wanting further help and advice. So, you know, the helpline is a complementary service if you have an Admiral nursing service in your area. But obviously, if you don't, we would always advise, please come to the helpline, 0800 888 6678. And for further information, go to the Dementia UK website. We share everything. You can download our resources, you can request our resources, you can read all our research, our publications. It's for everybody, because there's no good not sharing knowledge and information. We have information in the basic literature in 8 different languages, as do the Alzheimer's Society, and we use their resources openly. We work with the Alzheimer's Society because we're all about reaching the need. So, you know, we're really proud of the helpline. We also have the Closer to Home service, which is actually face-to-face virtual appointments that people can book by the Dementia UK helpline, where you can book your actual time and date that you want to speak to an Admiral nurse if you're a worker or whatever issues you've got. So you could actually pick a physical time and date and have a face-to-face consultation. And we also have clinics. And we have clinics within Admiral nursing services. We have clinics within different Admiral nursing services. And next year we will be having clinics with the Leeds Building Society in different Leeds Building Societies up and down the country. Go to the Dementia UK webpage, click on the clinics. All our jobs are advertised, usually on there or on NHS Jobs and any other opportunities within Dementia UK. So, you know, we're trying and we're increasing the amount of clinics and services out there to support and help and meet the needs. So thank you for having this opportunity just to tell you a little bit about the helpline and clinics. Thank you.
Thanks, Justine.
Thank you, Justine. And obviously, we work closely with all of these. So if ever there was a referral to us that didn't meet our criteria, which will be discussed later on, we would link with people like Ben at the Royal British Legions or the helpline and divert your referrals. We have put the link in for the Dementia UK helpline and resources in the chat as well. Can we have the next slide, please, Kate? Right, so a bit about us as Admiral Nurses and what we do. So we do work with the following the NHS Well pathway. So you may see us in areas promoting dementia, so that preventing well. You'll see our stalls. We'll be having time for cuppers, just to reduce that stigma of dementia really, and to just let people know that we are out there, and just to direct where people can find support and just to have someone to talk to. We also offer educational sessions, and this can be done to all professions, primary, secondary and voluntary, at different levels of support that you would require. Again, in regards to the referrals that we receive, the majority of them have already received a diagnosis of dementia or are waiting for that diagnosis formally to be given. So we don't really support in regards to the diagnosing well, but if we did have concerns, we work with people in the volunteer sector and social in regards to where to get that support. We can give them written information or education to direct them on services that can support them in attending these appointments to get the diagnosis really. And we work really closely with our MAS memory assessment services within the trust, and hoping to build those close relationships with our GPs as well. But our main, as Black Country term, bread and butter is the supporting and living well for our families. So this is where we try to empower our families caring for somebody living with dementia, and this would be to help them navigate through services and give them that support. giving them those tools and strategies to manage with some of the behaviours and challenges that come with a diagnosis of dementia and managing those risks. We also support our families, and we recognise the emotions that come with a diagnosis of dementia, so we'll be able to support them with those feelings of guilt and loss and that anticipated grief that comes with this. We help them transition into care, so the majority of our families we will be supporting at home in their own home environment. However, we recognise that sometimes their needs change and the family cannot meet their needs, or they need a bigger team, and we will help the families with the emotions that come with this, and we will help them with that process of relinquishing that care and transitioning into care homes. And with that said, we also support in regards to recognising the signs and symptoms of end of life for somebody living with dementia. So we will be having those sensitive conversations and educating the families and professionals, and we could be looking at future planning, having conversations about advanced care plans. We also implement the respect documents. We also offer bereavement support to families once the person with dementia's died, and then we would signpost them to more suitable services if they needed further bereavement support that we could not facilitate. Then we would refer them to maybe Compton or the bereavement hubs that are available within their boroughs. So that's a bit of us in a nutshell. I think we're on to our breakout rooms now.
Okay, so how's this going to work, the breakout rooms? Have we got Kate?
Yeah, hi Nick.
To explain all the technical with all of this.
You've all been allocated to a breakout room based on your preference. So hopefully Sandeep, who's arranging this, will organise you all into the relevant room. But we know with events that sometimes things go wrong. So if you're still in the main room, we'll get you to your room as soon as possible. But Sandeep, yeah, if you can organise that would be great.
Right, so we'll all see each other soon, but you'll fly virtually, fly virtually into these rooms now. So thank you, and thank you for the presentations. Thank you. Hello and welcome back. Hopefully, most people welcome back, and this is the time now to get some feedback from our facilitators from each of our breakout rooms, and obviously we will be writing up all of this, and it's great to have this recording, so we'll be able to write up a lot of the comments hopefully, and take some actions from this, and really help support our ongoing rollout of our Admiral Nurse service. So we have 4 boroughs, we should have hopefully 4 facilitators. So who I think, Sarah, you were quickest on the draw. So I'll let you go first. Sandwell.
Are you speaking, Claire, or do you want me to?
Claire, well, Claire's still on mute.
Do you want? Oh, it's got to be somebody else. Do you want me to, Sarah, or do you want to?
Yeah, you go for it, Claire.
That's
okay.
Great.
Okay, so we had a great discussion. Just obviously Sandwell's our very, 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 very newest part of the service. So yeah, it was maybe a slightly different structure and discussion to the other areas, but just obviously trying to meet up and link up with all the new services and all different services that might, and the existing services in Sandwell, and making sure everyone gets to meet Sarah. Sarah's obviously met a few of those services already as part of her induction role. So and it was good discussion about, how our services obviously, and having the path set up within existing dementia pathways, and how that might look, where we sort of sit within the pathway that each sort of dementia strategy group for each area has sort of found us to sit. Obviously we might cover a lot of different aspects of dementia support for families, but that supporting living and dying well with dementia is one of our main sort of bread and butter things, isn't it? So we talked a little bit about that. We talked a little bit about younger and rarer onset and things like that as well, around supporting around some of those things and how that might look, and how we'll be continuing to look at that from an NHS point of view, certainly into the future. And we sort of mentioned that we discussed that at our meeting yesterday, hadn't we? And how we work with partners around supporting families with those needs. We talked a bit about the Wednesday meetings, which again would be a new thing for Sandwell, but that, you know, obviously that we have a Wednesday meeting offer of support to drop in and have a chat about particular issues or potential referrals, and we're offering that within the 4 areas, and that meeting is live and good to go from next Wednesday for Sandwell. And there was some questions around self-referral as well, so but I think that will probably come up with Carol's slide, won't it, around that aspect of things, so I'll leave that for then. And obviously just establishing, you know, as I say, what we do within and alongside our dementia pathway partners for Sandwell, really. So some good contacts made, and obviously some fantastic work going on as it is in all the areas, really. So that's great. Thank you for everyone for coming along to that.
Great, sounds a really positive room there, and it's really exciting. It's early days, I know, in Sandwell. Sarah, I think you've only been in post in September, isn't it? So yeah, early days, but really exciting and great to have Admiral Nurses in Sandwell. Okay, so who's next? Which borough next? Stacey?
Giving the nod to Wanda, but yeah.
You're giving a nod to Wanda.
Giving the nod. I could see Wanda's little eyes. Shall I?
Okay, Wanda, I don't mind.
Do you want me to go next?
Okay, I'll go if that's all right. Get it out of the way. So me and Luke did the Warsaw breakout room, and again, quite similar to Sandwell, it was about just connecting and recognising some faces, really, and making those relationships that we already have that are probably over referral or emails. Seeing where we felt that we sat in the tiers of dementia support and where we sit on our borough's dementia pathway. We had the lovely opportunity, and I think the ladies left, she was in the wrong group, but actually she gave us some real good intake. She was one of the Dudleys carers. I think she's one of yours, Carol, and she was speaking about the her support of what she does for the crafts, for the volunteer sector. Yes,
Lisa, yeah. Brilliant.
But then she also brought up about her own lived experiences and how we can try and look at how we support families when they get that first diagnosis. And we spoke about how they're inundated with all this literature, and at the time it might be too overwhelming. So how we can look at us as dementia partners supporting them, really. And then it was brought up about where to refer to when there is that initial diagnosis. So yeah, it was a lot of connecting, really good. And again, we're going to hope to have those regular inputs with our dementia partners on a Wednesday to come to our allocation meetings, but also to our dementia strategy meetings. So we're all singing from the same sheet and know what we do, really.
Really, really important thing, that, isn't it? That people get lots, you know, of information and bombarded right at the beginning of people's journey, you know, and it's a really important observation. That's really valuable. Yeah, thank you for that. Thank you. Warsaw, that was. So is it off now to Wolverhampton?
Hi. Yeah,
Via Wednesbury.
Wolverhampton. So thanks to everybody that came into the breakout room for Wolverhampton. We had a little chat about the pathway and the little pyramid, the tiered model. So we had a little think about where all the services in Wolverhampton fit in with each other, and how we can move between services seamlessly, and how we can signpost to other services. We had a little chat about like the OAT service as well. So Oates, if you could put something in the chat box maybe with some contact details. Had a little chat about education, and when it is appropriate for us to do the education rather than the other services. So yeah, it was really great.
Really, really positive. Good, excellent. Okay, so Carol, last but not least, Dudley.
Hi, yes, we spoke about the pathway. We put the triangle of care up, and people put in the box where they see themselves in that triangle of care. And stressed about how well the pathway partners in Dudley work together and how well our Wednesday meeting has been going, and for the past two and a bit something years, and got those pathway partners to introduce themselves and say briefly what their services did, stressing how important it is for upon diagnosis to refer to all three services. And also we looked at the very complicated pathway for Dudley, and we tried to make head nor tail and just briefly pointed out where we sat in that and the services that are around us to support in that. So yeah, it was good, and we certainly spoke about the Wednesday meeting and encouraged anybody who has their requesting a referral or think they may need a referral to contact us directly, and Claire and I would speak with them before filling in the now less complicated referral form that is coming out for Dudley. So yeah, it was good.
That's great, thank you so much. I hope people found that useful and valuable, those breakout rooms. It really is all about, you know, getting to know each other, isn't it, and getting to understand, you know, what the offers are from Admiral Nursing, but also what is out there. And I know it's a very, very complicated place out there. There's lots of people doing really, really good bits of work around dementia care and dementia pathways, and it's getting those all joined up together, isn't it? So we're all working in collaboration together. So I do hope that's been valuable for all of you. And now, is there any other further questions in the chat or anything that I need to address on that one at all, or are we okay to move on to the next part of the agenda? I think the next part is the referral data diversity and carer story, and it's Stacey.
So over to Carol and Sarah.
Oh, Carol.
Yeah.
Okay.
Yeah, the referral criteria, and this is for the whole of the Black Country now that we're joined as one. So as it states below, the referral criteria is also on the referral form, just to remind you of it. So the family, it's the carer who is the person that is referred to the Admiral Nurses, not the person with dementia, although obviously we inadvertently support the person with dementia as well, but the referred person on the form has to be the carer. They must be providing support and care at home for a person living with dementia with a formal diagnosis, which is recorded on EMIS clinical web portal or any other GP system. As the Admiral Nurses, we don't have access to the spine, so we're unable to access information. That's why it's so important to get the form completed fully. Both family and the person living with dementia must live in one of the Black Country boroughs and have a registered GP within one of those boroughs as well. And we have the, as discussed previously, the closer to home services, the Admiral Nurse closer to home services, and the helpline can assist if this isn't the case, and the other services in each borough as well. The family and care, the family care and needs cannot be met by any other services. So, example, the Gateway, the Alzheimer's Society, other support agencies. So when they can no longer be met by those services, then referral to us is appropriate. And we do not, the carer must consent to the referral, and that must be documented on the referral. Also pointing out as well that you have a family where there can be 4 or 5 carers, or even 2 or 3, and it needs to be one carer, the main carer, that is put on the referral form. So that there's one person that we liaise with in that family, because we've had referral forms that have got 3 or 4 people on them, and so we just need one. The one and more following criteria must also be met, and that is that the family are struggling to care for and cope with the managing the risks and the challenging needs of the presentation of the person living with dementia. The family carer feels unable to cope with caring due to the feelings of loss, guilt, stress, and or depression. And we all know the support needed for carers for that anticipatory loss and ongoing grief, and that transition of care, excuse me, and transition of the developing dementia as well. The family carer can feel are neglecting their own physical and mental health needs due to their caring role, which we see very, very often. And often the carer has multiple comorbidities and health needs as well, that is making it difficult for them to care. The carer needs support with psychological interventions to help them with adjust and develop the skills to support those complex needs, particularly around the periods of transition. That can be from one stage to another in their dementia, and that can be the transition into supported care at home or full-time care elsewhere. That transition is difficult. We can support with that. Where conflict has arisen, which we very often see, family dynamics changes when caring for somebody living with dementia. So when this is affecting the ability for the carer to care for that person, then a referral is appropriate. And the family carer requires support and recognition, adjusting and coping with the end of life. And that's where we work closely with our palliative care, hospice teams, Macmillan, all to be involved and recognising again that dementia is a life-limiting disease. So it's using those services as appropriate as well. And we do discuss end of life care, advanced care planning, future planning, respect documents. So all important. So one of those criteria must be met when referring to us. Unfortunately, we're not able to accept self-referrals. We're very, very small teams, and so we're unable to accept them. And we're unable as well to accept referrals from formal employed carers. It's a health or social care referrer really. So we're not able to refer them. The Admiral Nurse referral box is where the referrals need to be sent to. And if you need to discuss any other information with us regarding a referral or a family or a case or a possible case, then those emails need to be sent to our private boxes. This referrals inbox is purely for the referrals, and they will be picked up by Dorothy, our admin, and allocated and discussed in our meetings on a Wednesday. We're not commissioned as an emergency service. We're not commissioned as a crisis service. So for, if that is needed, then you need to look into your social care, healthcare, crisis services. But we're an 8 till 4 Monday to Friday service. So it's just taking that on board as well. I think that's it for the I think that's it for the referral process, unless anybody's got anything else to ask or that I've missed out.
I think Carol's already mentioned a lot of the things on this slide, so I'll just reiterate it. The Admiral Nurse service accepts referrals from health and social care services within the primary, secondary and voluntary sectors. But as Carol said, unfortunately, at present, we don't accept self-referrals. So the person that you would be referring is the carer of somebody who has a diagnosis of dementia or is awaiting a diagnosis of dementia. And again, like Carol mentioned, this doesn't include paid formal carers, so it is informal carers. All we ask is that you fill in the form as detailed as you possibly can, and try and include as much information as possible so that this doesn't delay the referral process. If you're aware of any services that are already involved, it's really helpful to us if you include those on the form, because sometimes we'll receive referrals where actually there aren't any other partners involved already, and really they need to be explored first. It's really important as well that you put the carer's date of birth and their GP on, just so that obviously it's within the Black Country area. So basically, as as Carol has already mentioned, we're not commissioned as an emergency service. Unfortunately, we work Monday to Friday, 8 till 4, but we do obviously have the helpline in the event of when we're not there. We don't work bank holidays and weekends. Once the referral's received, we aim to make contact with the person that's been referred within 5 days of receiving that referral. And I think that one of my colleagues is going to pop the referral form into the chat box, but it has been launched now on the intranet site for those of you that work within the Black Country, and that the form will be popped onto the chat. So hopefully that covers the referral process.
Sorry, can I just add, there's something that I missed actually on my slide, and that was to say that we no longer are able to accept referrals for the person with dementia who's already in a care home. So they have to be actively caring for somebody in their homes. Sorry.
I think that just does answer one of the questions on the chat as well. I think someone from Warsaw has asked around care home support. Okay, so okay. Right.
I think it's time for you now, Claire.
Oh, lovely. Okay. So just to talk a little bit about where we've got to so far and where we've come from, really. So some little pictures just to give a bit of a taster of some of the things we've been doing alongside the direct work with families and communities. So I think someone mentioned certainly in our breakout room about the event we did down at Merry Hill fairly recently, which was organised by the Dudley Living Well and Feeling Safe Partnership, and we were there alongside. That's actually a picture of us as the Admiral Nursing team there, but and with Kate, our British Legion Admiral Nursing colleague as well, who I think is on the meeting. But you know, it was a really good event, and the footfall at Merry Hill obviously extends way beyond Dudley, which is great. It was an opportunity to meet people from across the boroughs who were just out shopping that day and weren't expecting to see us. So and you know, we were there alongside our local authority and Alzheimer's Society colleagues on that particular day. And then I think the middle one, Stacey, is that the time for a cuppa?
Yes, time for a couple of our Warsaw Admiral Nurse Anne. We raised £40 that day.
Okay, lovely. Okay, and that's Lee in the middle there, isn't it? If I'm not mistaken, from the Alzheimer's Society. And then on the other end there, that's at Wolverhampton. I think that's Wandering in the middle there, isn't it? Excuse my eyesight, it's a picture small on my screen. And again, so just it is you, isn't it, my darling?
And Lee again.
And Lee again, and Lee again, and Lee was at Merry Hill as well. Lee's always where we are. So, and again, that's I think he's here, isn't he, today? Yes, he is. And oh yes, I can see you, Lee. And yeah, it's about demonstrating that, you know, we're out there, we're doing other things, and again, that's about trying to sort of increase our community presence really, and make sure the work of the team and how we're working alongside other dementia care pathway services is sort of promoted out in the communities which we serve. Okay, so in terms of the services then, okay, so as you can see there, we've been around for a little while now, although the service continues to expand, as been mentioned before. I think we have sort of 403 referrals now overall from the time that the service started, but that doesn't include some of the ones from the original Dudley service. And also we're currently supporting around 196 families in the 3 communities, and obviously that will extend into the Sandwell community as of today. Okay, so the Dudley service commenced in August 2020, and then the Wolverhampton service commenced in August 2021. The Warsaw branch of the service then started in May 2022 this year, and then in July this year the Dudley service merged and it was tupied across to this Black Country Trust and merged in with the rest of the teams. And then in September this year, obviously, our 2 latest members of staff joined the team, which is Sarah and Danita. We're obviously very privileged to have them as part of our team now. So Sarah, as you know, is going to be our Samuel Admiral Nurse, and Danita, who's also on the meeting, is our new Diversity Admiral Nurse lead. So we're very pleased really to announce that Samuel service is actually launching today, and we're good to go. So which is really great. Okay, so we think, going back to sort of the numbers, we think probably around 25 up to 25% of those referrals, I think has been mentioned before, it's probably around younger onset dementias and rarer dementias, so the relative who's supporting someone with a rarer dementia. I think it's really important to raise that and acknowledge that that's, a significant part of the work that we do in supporting families from very, with very diverse needs. And I think it's useful to note that obviously within the team, there are a variety of nursing backgrounds. So we cover all the adult branches. There are RGNs, RMNs, and learning disability nursing covered within the branches of the nurses in the team. So within that, our sort of specialist backgrounds are in hospice work, hospital work, community learning disability, community mental health, memory assessment, district nursing, palliative and end of life care working as well. So, and I think, that hopefully, attempts to demonstrate really some of the clinical expertise we can be supporting the families in the various communities with. And obviously with Danita joining the team now, that's she's going to be talking a little bit about that in a while, but it's about extending and making sure we're serving all of the communities and everyone in a way in which is suitable for them and meets their needs. Okay, so let's just have a little look here. I'm losing my way here now. Sorry about that. There has been research obviously going on within the team. So that was carried out earlier this year, and that's still ongoing now. And that was done with Dementia UK, with NHS Ethics. So that research study was undertaken by Dementia UK. It's aimed to understand the impact of Admiral Nurses and what, the impact they have on those families living with dementia that they work with. It used a realist approach and explored in depth really in a more qualitative way really about how the difference that Admiral Nurses made to those families and the teams that were in the service at the time were participating in that research. So it was they were observed during the months of May, and 2 of the nurses were recruited alongside 10 families that were being seen by the team at that time. Okay, so it's still in its analysis phase, so the actual results of that haven't completely come through yet, but we're in no doubt really that it will support the role of the Admiral Nurse being more clearly defined, because that was one of the sort of aims of that research really. So it was really good to be part of that. Okay. So the other thing we just wanted to sort of mention really was, but obviously with that sort of wide background of specialisms that the different nurses have come from really, that it really has allowed us to sort of forge forward with some of the respect work and end of life conversations work with families, and also around how we're working with and supporting families whose family member may go into hospital, and the links are really coming on well now with those local hospital services that our different communities might access. So that's been really helpful as well really to kind of sort of see how that sort of works alongside those teams that we already have in different hospitals across the 4 boroughs. Okay, so again, I think we're just hoping really to sort of recognise that sort of uniqueness really of the 4 areas and make sure that we continue to sort of look at how the 4 areas of the Black Country work and sort of diversify really, and make sure that we're kind of coming along with the plans for the 4 areas as well as providing some equality of service across the whole boroughs. Okay, thank you.
Thank you. Cheers, Claire. Next.
So my name's Danita. I've only just been in the post the 1st of September, and my main role is working with the diverse communities in the 4 boroughs. So in front of you is the data of referrals which we have received from the ethnic minorities from all boroughs. And if you can see, there is a section which states not known and not stated, which may be due to the carer not opting into the service prior to an assessment. And also there's a high percentage of referrals received from the white communities, and there's a very small percentage from the ethnic minorities. However, hopefully me being in post and people being more aware of me being in post, there should be an increase in the percentage of communities. And just that research obviously shows that people from the diverse communities are more of a risk of developing dementia, and because they do mainly have like diabetes, high blood pressure, and they also suffer from stroke. Despite of them being reluctant to access services, they also believe that dementia is a label of being crazy and someone as being incompetent, mad, and also a disgrace. And all these labels are associated with stigma. They think that it's contagious. It's a contagious disease which can be passed on. So therefore, families and friends disconnect and separate, and it's all a taboo. Therefore, people don't want to admit that they have dementia, so they don't seek help, and they don't want to be seen in groups. They don't want to be seen in hospitals, and therefore they become more isolated, and they just refuse to ask for the help or reach out for help because they feel quite embarrassed. And as soon as you mention the word dementia or mental health, people automatically believe that they're mad. And also some of the barriers can be language, which is a massive barrier as people rely on their first language. Also assessment tools that are used, for example, the MMSE. I mean, I don't think it's appropriate for someone whose first language isn't English. And also, majority of the diverse communities, they want to be caring for their own, so therefore they're reluctant to get help and support, and they don't want to be seen as if they're not wanting to care for their loved ones. And just the next slide. So the diverse Admiral Nurse role is to improve experiences of carers, families affected by dementia from diverse and underserved backgrounds and complex needs. And also to work closely with other health professionals and social and voluntary sectors to achieve coordinated and integrated care. This would also help to identify any gaps so that we as a whole can improve experiences and the services provided to the people from the diverse communities. And also my aim is to offer basic education to improve awareness and encourage people to maintain a healthy lifestyle, and also for them to seek help with reducing alcohol and also smoking. Unfortunately, there's no word for dementia. Therefore, most people associate it with mental health. Therefore, we need to encourage and convince people that they can live well with a diagnosis of dementia by accessing services and putting things in place And we also need to reassure them that they can live a comfortable life with a diagnosis of dementia, and that we are there to help and support them throughout the process. Financially, refer them to services which would help and support them with financial issues, and also attending groups. We had a look at a table from Poppy, projecting older people population information system, which shows that Wolverhampton has the highest percentage of Asian people, and also has a high percentage of people from the African Caribbean community. And also it's hard to give an accurate number or information on how many people have a diagnosis of dementia in the UK from the ethnic minorities, because people don't seek help and advice and support. However, there are general figures. The table from Poppy, the information and the figures were taken from Census 2011, which suggests that 8,050 people in the UK live with a diagnosis of dementia, and out of that, 25,000 are from the ethnic minorities. However, this is not specifically in the UK, but that's only England and Wales, and it's forecast that it will raise to 50,000 in 2026 and over 172,000 in 2051. So I think that's it, really.
Thank you. Yes, a really exciting development for ourselves in the Black Country, and one of the things that people working in the Black Country, you know, really recognise and cherish as well, the fact that it's such a enriched, multicultural area of the Black Country. And you know, it's really valuable having the likes of this initiative and other initiatives that I know a lot of us are trying to work with at the moment, in trying to really make sure, you know, that we have equality of services that are able to engage and reach and support all of our areas of our communities. So it's a really great development, and welcome Danita, another recent recruit as well. So it's a fantastic initiative, and every success to that. Okay, so now over to you, is it Stacey?
Yes, and thank you to Danita. And it'd be great if we have the opportunity, maybe in a year's time, to bring that data back and to see how many more people we are having referred because of Danita's input. It'd be nice to be able to compare that. So hopefully we can bring that in a year or two. So now this bit we have
Stacey.
Yeah?
Stacey, sorry to interrupt. Just before you go on, Jacqueline Rogers had her hand up. I'm not sure if she wanted to say something.
Sorry,
Yeah.
Jacqueline.
Yeah. Sorry, I know the timing's quite tight, but Danita, it's great to have you on board. But it's just to let you know, like from Warsaw perspective, and I'm sure if you wanted to tap in with us, we do very much work closely with interpreting services. We've got a broad range of literature and various assessment tools that we use for our community. So you're welcome just to step into one of our meetings on a Thursday if you like. You're welcome.
Oh, thank
you.
Thank you.
Brilliant.
I'll take your details, Jackie, and send you an email.
Thank you. Thanks.
Yeah.
That's it, Nick. Thank you.
Apologies for the appalling comparing. Sorry, Jackie, I missed you.
All right.
Okay, thank you. Sorry. Okay, Stacey.
Right, thank you, Jackie. So now is the important bit, really, is to just hear from somebody with the lived experience of their input. So we have Gary, who's one of our carers. On the screen is a poem that Gary has written. Gary, I'm not sure if you can hear us.
Morning, everybody.
Morning, Gary. Thank you for coming.
Yeah. Thank you for inviting me. Yes, I am. Thank you.
And I know we're disrupting you in the middle of a yoga class, so I don't want to keep your time, but obviously you have had input with the Admiral Nurses, and you've got that lived experience as a carer with your mum, and you've wrote such a powerful poem that we felt that we needed to share it with others. So do you want to just give us a bit of insight about you, mum, and where we got to, really?
Yeah, thank you. And I appreciate the opportunity just to give a little bit of input here to the incredible work that you're all doing too. So I came across Admiral Nurses some point early in the year, but it was when Stacey contacted me, probably around March, I'm guessing, that I got to meet Stacey, and I'll tell you how that meeting went in a moment. But the background here is I live with Mom. She's now 92, and as soon as we pretty much shut the door on the pandemic, so I went into shielding mode, and the real obviousness of her dementia suddenly became apparent. I think to a degree it's probably, for a lot of families, you sort of scoot around it, you know that there's some issues there, but the pandemic really kind of slammed, you know, everything really hard instantly, and that was a tough time. So pretty much from the first day of the pandemic, things became challenging immediately, and yet I was very much committed, as you might expect, you know, to keeping Mom safe and looking after her. And I wasn't fazed by the pandemic or however long it might last. So my experience compared to my expectation was something entirely different. And you kind of are all aware probably of the, you know, the challenges of looking after somebody on your own with no break. It was 25 months before I got a day off from doing that. So that was an incredible long time to have to kind of go through that, the two of us. But it was in, yeah, I think about March at that point when Stacey called me, and that was my first contact with Admiral Nurses at that point. And I wasn't sure what to expect. Stacey booked an appointment to come and see us, and I actually thought it was just going to be a little bit of spiel about the service and what we do. But what massively impressed me at the time was that, Stacey, you just launched straight in. We went for a walk up to the park up the road, and I was able to start really offloading, and you allowed me to do that because I was in February, March, as the poem might suggest, was in a very, very dark place, a very different place to where I am right now, really. So yeah, that became 2 hours, I think we spent that first day. But you know, looking back, and even at the time was pretty pivotal in the trajectory that I was on and changing it, because it was, yeah, incredibly. I was in a place of despair. Let's just put it like that, and that's not a good place to continue your life from, because life looks like it's narrowing and going down time. So I was in a desperate place, you know, and ultimately the real reason for that was lack of respite. So I'm not going to, you know, make out that it was Mom or the challenges here. It's just doing what I have to do, as so many carers do, without having the opportunity to have a break. And actually more than that, because the poem, when you know, you might want to talk about it in a moment, you know, reflects some of the things in my experience too. So that was incredibly important in my life, I would say. I think in some of the feedback I gave you later down the line, written feedback, I said that it was potentially life-saving, and that wasn't an exaggeration, because of how I felt in February, at the beginning of this year. So your listening, your awareness of my situation, your understanding of what I was going through, which is reflected in the poem. Really, this idea that nobody really gets it. Was something I was suffering from. So yeah, that's I'll talk more about that maybe in a second. But that's how that's my background with what I'm doing with Mom. Obviously, I had to give everything up. Everything in my life just stopped. Everything. I know for most people, the pandemic produced that for most people, but later on, you know, looking after somebody with the fiercest period of her dementia as well. You know, she's very much more frail now and a bit quieter, still incredibly demanding. But at that time, it was really, really, really incredibly difficult. And yeah, so when you appeared, you know, it was a turning point really in wherever I could have carried on going. So thank you.
Thank you, Gary, and thank you for sharing your story and your poem, and just for everyone's sake, just to talk about where are you at now, because obviously we're interrupting you while you're doing a yoga class, and those were forgiven. So it'd just be nice to know where you've come from this poem, really, because you've had a very challenging journey and you've done a wonderful job with Mum. So it's just nice to show a bit of a ray of sunshine on this journey.
Sure, yeah. Because that I mean I look at that poem and I know that actually it wasn't done as a poem. I sat down in a chair one night in February, I think on the 7th of February, and pretty much in its entirety that just spilled out. I might have tidied up the odd line here and there as I was going, so it wasn't intended to be a poem. So it's you know, I feel very humble that people refer to it as a poem. It was just really a pouring out of emotion from a place of despair, from a place where I was exhausted, you know, all these things that carers experience too. But really the principal themes that are contained in those set of words are what it's like to go beyond burnout. Because you don't, you know, burnout is bad enough, carer burnout, but when you go beyond that, what happens? You know, something is happening and it's terrible. And I was in a place of incredible despair, desperation, exhaustion, thinking the darkest thoughts that you would want to think. And at the same time, the other things that are reflected in there is this kind of experience that nobody understands what you're, you know, going through. Nobody, family, nobody. That's why when you came along, it was the first time I thought, yeah, you get it. And that was such an uplifting thing to be validated at the time. And you talked about anticipatory grief. I heard that mentioned just, you know, not too long ago in your discussions. But there were other things going on. I was telling you experiences that I was having that I had no labels for. And because of your support and then the caring and coping group, and that leading me into trying to understand what I had been experiencing. So I started to really find that these things that I was experiencing that I thought were all about me were a thing that was happening to me. And that distinction saved my life, probably. So all this stuff about feeling alienated, what I now know is called disenfranchised grief, you know, so the grief is far reaching, you know, when you're looking after somebody with dementia. That sense that nobody understands. It can demolish, wreck, destroy your social networks. So all that has to be rebuilt or, you know, redesigned. It's an awful experience. It's not just caring for the person. It's what it does to your life, you know, on the outside as well. So that's been one of the major sufferings, I would say, for me, and that's sort of reflected in the poem as well. So from that, you know, the caring and coping group, when I did the 7 weeks that you offered, which is absolutely incredible. I think all the participants on that feel the same as well. But I know they do, because we're still in touch. That was a real powerful period where we could begin to realise that, yeah, the feelings, especially the anger and the despair, were not something that was a failing within ourselves, but were a product of the circumstances that we found ourselves in. And that was a really, really highly beneficial period for me, that course, and it placed me in a brilliant place, to the point that come midsummer, late summer, I was thinking about opening up my life again, doing my yoga, returning to teaching in small parts. That only happened a fortnight ago, really. And I have a lovely one-to-one client in here with me this morning, just to highlight the fact that, yeah, you're now catching me from a place of joy and positivity, and, you know, a taste of my own life. Whereas in February, there was nothing of my own life that felt like was there anymore. It didn't exist, and that was terrible. So there's still work to do. I'm still, you know, having to, I always say, how do you suffer from something that you're still experiencing? Sorry, how do you recover from something that you're still suffering from or experiencing? So I'm still looking after Mom. Those demands don't go away. But at least now I am far better resourced and informed, and have support, you know, from yourself than I had this time last year, because my decline into, you know, a really desperate place probably began in earnest just around about Christmas time last year. And yeah, so I'm very happy to report this morning that I'm feeling a lot brighter. My t-shirt doesn't give that away anyway. And yeah, and the service has been incredible. And I appreciate, you know, anything that, all the advice that you continue to offer to help me manage what is an ever-changing situation with Mom, and things don't get better, really, sadly. And I appreciate this moment to be with you all, to sort of share that if it helps as well.
Thank you. And thank you, Gary. There's some lovely comments about your poem and your words. You're very beautiful with words and how you articulate, and we're really grateful. And I think from everyone in the room, you're doing a wonderful job with Mom, and we really appreciate you sharing your story today.
That's my pleasure. Anytime.
Thank you. Enjoy your yoga.
Yeah. Gary, Stacey took the words right out of my mouth. Gary, I was going to say how you articulated that was just fantastic, and it's really appreciated. And I can see all the comments from the poem as well, and I'm really grateful that you spent your time here today with us, because, you know, your experiences and how you've articulated that are, you know, why we are here today, trying to do this and make sure this service can offer a similar service to many more people as well. So thank you.
Absolutely. The more people it can reach, like I said, just, you know, if there's the poem's one thing, but if there's anything you can take away for a lot of carers, this service could be life-saving,
absolutely,
and life-changing, you know. So yeah, that's how critical it is, really. So yeah, thank you. Anytime that I can help.
Really appreciate it. That's fantastic. Thank you very much. Thank you. And as you can see, we've got, thank you. As you can see, cheers, Gary. Thank you. As you can see, we've got a list here as part of this presentation as well. We've got a list of all the contacts there, the email addresses, etc. as well, which is, you know, obviously how to get in touch with us as well. Sorry. Sorry, I don't know how that happened. I've been muted by somebody inadvertently, I think. So certainly, you know, I hope that, you know, the presentations of today have been really helpful, and I hope it's really given you an idea of obviously what we're looking to offer, and we are offering today at the moment as well, and also how to access us, you know, also the importance of this service as well across the Black Country. And again, as I started off before, I said, you know, I was really delighted, you know, that we have this service now in the Black Country covering all of our 4 boroughs. And there's lots and lots of questions that we have within the chat. I appreciate the time as well, because we have run over as well. I'm happy because I would like to think that the recording of this can actually go onto our YouTube channel, so people can actually watch this, you know, a lot more people can watch this. So can I just say to everybody, I'm really, really grateful and thank you for all of your time today and all of your contributions, from all the people presenting, all the people in the chat rooms, yourselves contributing as people, as guests to this stakeholder event. I would like to have the video that we couldn't get the sound. I'd like if that could be played now. If anybody is running late for meetings or running late to go out and see people or whatever, you know, by all means, you know, you can watch it later. But if we have this if we have this as part of this recording now, then this can be something that can be shown later on as well, if that's okay. So with no further ado, I think hopefully we've got sound with it this time. We've been doing some work on the breaks and stuff. So if we just like to play this video, which really does also help as well, everything that Gary has said and spoken about his experiences, hopefully this animation will also show the real importance of this service. Thank you. More powerful stuff, isn't it? Thank you everybody again for all your contributions, and I hope it's been of I found it very, very valuable, and I hope it's been of value for everybody concerned who've been here today. So thank you again for all of your help in driving this service forward further for the future, and congratulations to the Black Country for having got so far already. So everybody, thank you and take care, and hopefully see you all soon.